Have you ever walked into a room and completely forgotten why you went in? Now imagine feeling like that all day, every day. Scary, right? That's Alzheimer's disease, when your brain starts ghosting you. Hey buddies, welcome back to DocDecoded, and this is another episode of Disease Decoded, where we turn scary medical stuff into snack-sized knowledge nuggets. Today, we're diving into one of the most emotionally devastating conditions out there. Alzheimer's disease, the most common cause of dementia, what we've already discussed. Check the video in the I button. From subtle forgetfulness to complete memory loss, this disease turns reality into a fog. Stick around till the end, and I promise, you'll walk away remembering more about the disease. That makes people forget. What is Alzheimer's disease? Alzheimer's is a progressive neurodegenerative disease, which is a fancy way of saying your brain cells slowly start dying over time. It primarily affects memory, thinking, behavior, and daily functioning. Named after Dr. Alois Alzheimer, who first described it in 1906, it's the most common cause of dementia, accounting 60 to 80% of cases. Think of your brain as a city. Neurons are like buildings and roads. In Alzheimer's, the roads get blocked, buildings collapse, and soon nothing works. When and how does it begin? Although it's more common in people over 65, Alzheimer's can start as early as your 30s or 40s. It usually begins with short-term memory loss, forgetting recent conversations, misplacing keys, or missing appointments. But here's the twist. Not everyone starts with memory loss. About 20% of patients may first show trouble finding the right words, difficulty organizing tasks, navigational problems like getting lost in familiar places. Some unusual starting symptoms include problems with visual processing due to posterior cortical atrophy, logopenic aphasia, that is trouble naming things, or repeating words. These people may not show memory loss for years, but eventually develop typical Alzheimer's symptoms. Some may even show stiffness and movement problems known as corticobasal syndrome. In frontal variant of AD, changes in behavior, mood, and personality. Even depression, anxiety, or social withdrawal can be early warning signs, often years before the memory issues start. Stages of Alzheimer's disease. Alzheimer's doesn't just arrive overnight. It sneaks in, stage by stage. Stage 1. Subjective cognitive decline. The person feels their memory is slipping, but tests are normal, often mistaken for just getting older. 2. Mild cognitive impairment, MCI. Memory issues show up in tests, but daily life isn't affected much. Around 12% per year progress to full-blown Alzheimer's. 3. Early symptomatic AD. Subtle symptoms show up, but people can still function independently. Brain scans or spinal fluid may already show Alzheimer's pathology. 4. Preclinical AD, no symptoms yet. But inside the brain, amyloid and tau proteins are silently building up. These changes can start 20 years before symptoms. What happens inside the brain? Let's get sciencey. But keep it simple. In Alzheimer's, two main villains hijack the brain. 1. Amyloid plaques, clumps of sticky protein fragments that collect between brain cells. They also build up in blood vessels. 2. Neurofibrillary tangles, tau tangles, twisted protein strands inside neurons that strangle them from within. Imagine your brain is throwing a party. Amyloid blocks the door and tau wrecks the furniture. These villains block communication between neurons or kill brain cells. There is shrinkage of brain tissue, especially in memory areas like the hippocampus. By the time symptoms appear, this silent destruction has already been happening for years. Common symptoms of Alzheimer's. How do you know if someone's just aging or something more is going on? Here are some classic symptoms. Memory loss affecting daily life, especially recent info. Struggling with familiar tasks, like cooking or using a phone. Language issues, like forgetting words mid-sentence. Getting lost in familiar places. Mood swings, irritability, or paranoia. Poor judgment, like wearing a jacket in June. Over time, the symptoms become severe. Not recognizing family, forgetting how to eat, dress, or even speak properly. Here's a real-life example. Mrs. Ava, a retired math teacher, once asked her daughter how to use a spoon. That's when the family knew something was deeply wrong. Late-stage symptoms. Alzheimer's doesn't just affect memory. It can affect movement too. Apraxia, difficulty doing tasks, like brushing teeth or buttoning a shirt. Walking with small, shuffling steps. Stiffness or slowness, like Parkinson's, without the tremor. Trouble solving simple puzzles or drawing shapes. Patients may wander around at night, confuse day with night, develop delusions, like thinking someone stole their things, show disinhibition, saying or doing inappropriate things. Eventually, they may lose awareness of their condition. Anosognosia. The most are aware in early stages. Big life events, travel, hospitalization can cause sudden worsening. Surprisingly, Many patients can still hold polite conversations even in the later stages. What happens in the final stage? As Alzheimer's reaches its final chapter, people become mute, rigid, bedbound, can't speak or recognize loved ones, lose bladder and bowel control, may have seizures or myoclonic jerks, sudden muscle twitches, their bodies become weak, and they're prone to infections. Pneumonia from food entering the lungs, as they forget how to swallow, even to chew in between. This is called aspiration. They need constant care, round the clock. What causes it? Risk factors. Is it fate, bad luck, or something we can control? Here are the known risk factors. Age. Most cases happen after 65. Family history. If parents or siblings had it, your risk goes up. Chronic illness, diabetes, hypertension, obesity. Genetics. APOE4 gene increases risk. Low physical or mental activity. Poor sleep or smoking. Interesting stat. Women are more affected than men. Not because they talk more. Easy, folks. But possibly due to hormonal differences and longer lifespan. How strong the genetics links to Alzheimer's. Certain genes play a major role in the development of Alzheimer's disease, IAD, especially early onset ones. Let's break them down. APP gene, chromosome 21. This gene is located on chromosome 21. The same chromosome involved in Down syndrome, also called trisomy 21. Adults with Down syndrome almost always develop Alzheimer's-like changes in the brain if they live past age 40. Why? Because they have an extra copy of the APP gene, which leads to too much amyloid protein, one of the main culprits in Alzheimer's. This makes Alzheimer's very common in adults with Down syndrome. Familial Alzheimer's disease, FAD, early onset cases. Some families have a rare inherited form of Alzheimer's that appears much earlier in life, before age 60 or even 50. This is called familial Alzheimer's disease, FAD, and is passed on in an autosomal dominant way, meaning only one copy of the faulty gene from a parent can cause it. Many of these families have mutations in the APP gene, presenilin genes, PSN1 and PSN2. Both presenilin proteins are found in neurons throughout the nervous system and help regulate how amyloid protein is handled in the brain. PSN1 on chromosome 14. This gene makes presenilin 1, a protein that helps process amyloid in brain cells. Mutations here are the most common cause of early onset familial AD. Over 100 different mutations in PSEN1 have been found across many ethnic groups. PSEN2 on chromosome 1, less common than PSEN1 mutation, first discovered in a group of American families with Volga German ancestry. These genes are linked, especially with early onset Alzheimer's, often seen in multiple family members and passed on genetically. How long does Alzheimer's last? After diagnosis, the average survival is 8 to 10 years, heavily depend on rate of progression. But it can range from 1 to 25 years depending on health and care. Some people decline rapidly, others stay stable for years. So the next time someone forgets your name, don't just brush it off. Can you prevent Alzheimer's? You can't change your age or genes, but you can lower your risk. Try the NeuroPlan. Eat a brain-friendly diet, like the Mediterranean diet. Keep learning. Use it or lose it. Prioritize sleep. Manage your BP, sugar, and cholesterol. Exercise regularly. Quit smoking and limit alcohol. Get curious. It could be something deeper. Stay socially connected. Talk, laugh, meet people. Yes, go out and ghost your phone instead of your friend. We are coming up with more on Alzheimer very soon. Smash that like button if you learned something new today. Drop an emoji in the comments if you're walking away wiser. And subscribe to DocDecoded for more deep dives into health. Decoded for you. Until next time, stay sharp, stay kind, and don't forget to remember.